Last week, I began an analysis of the health of Idaho's rural hospitals after the Chartist Group released a study that found as many as 80% of those rural hospitals could be running in the red. I spoke with the Idaho Department of Health and Welfare this week to compare their data with Chartist's and to get a better idea of the situation on the ground. Though IDHW's numbers are different than Chartist's, Gina Pannell, the Bureau Chief of Rural Health and Primary Care with IDHW, said she wouldn't outright discount either set of numbers.
The data that we have says that about half or just over half of our hospitals are operating with 1% or less of a margin. So what that doesn't tell you is that if it's in the red or not, but what I can say is that 1% or less is a very thin line.
Obtaining, interpreting, and disseminating performance data on medical institutions can be very difficult, requiring analysis of insurance, government programs, and other patient and practitioner support programs that inject cash into the system. Even Pannell said IDHW doesn't have a complete picture of how Idaho's rural hospitals are struggling. Despite lacking a complete picture, IDHW says they're very familiar with the impact COVID-19 has had on Idaho's rural hospitals, as well as how an increase in Medicare and Medicaid enrollment has changed how hospitals do business.
Nature of COVID and some of the political pieces that came with it, I think there was a delay in care that some of our Idahoans, nationwide, Americans, whatever you want to call it, delay care. And so when you're not visiting the hospital or the clinics, then that's going to affect revenue. And I would also add to that specific circumstance is that our rural hospitals they're resourced differently than our larger urban setting who may have a full financial department and multiple claims processing staff.
Part of what makes claims in the presence of high Medicare and Medicaid enrollment a complicating factor is that rural hospitals possess less resources than urban centers, often setting them behind to a point where unfulfilled claims often have to get written off at the end of the year as the cost of business.
Kind of just gets pushed further and further down the line because they get more and more overwhelmed and swamped into the revenue that they should be generating. And at some point, they're going to have to write some of those claims off because they do not have the bandwidth to continue processing.
These factors, made worse by things like staff burnout and turnover across Idaho's rural hospitals, have left Pannell and many at IDHW worried about the long-term health of Idaho's rural hospital system, and in turn, Idaho's rural communities. As part of my continued investigation into the health of Idaho's rural hospitals, I'll be turning to the Idaho Hospital Association, and I've also reached out to local health networks, including St. Luke's and St. Alphonsus, to hear their perspectives on the state of rural health. We'll also be taking a look at how rural healthcare systems benefit communities from an employment perspective, as they're often a top employer in their given communities. In studio, I'm Dakota Castetz, DJ, reporting.